So with that, I actually want to now switch to an introduction of our very special speaker, Dr. Ginny Mindell from the University College of London. I was really excited to read about her background. You may or may not know I came from a medical school, and to see an epidemiologist that's so engaged in this important question, I think is really a unique perspective that she brings to the interface of health and transportation. She's also a very distinguished scholar. She's a fellow of the Royal College of Physicians. And she really works, again, to bring to life the research that we're doing for solving problems. And it's clear she's had leadership roles in transportation and health study group for over 20 years now. So this is not to downplay her scholarly accomplishments. She's contributed more than 300 publications to the field and has the role of editor-in-chief of the Journal of Transport and Health. And I also will say she exemplifies the healthy living approach to a community, because her LinkedIn profile picture is her on a bicycle. So I guess you live what you say. We really look forward to hearing her insights, as globally engaged research is so key to really tackling these big challenges that face society, and her talk, Assessing and Valuing the Barrier Effects of Busy Roads. So thank you so much for joining us here today at the conference.
Thank you. Does anybody know how I can get the screen to show me what's behind me? Just linking to what we've just heard, it's not just any old bike, it is a bike share bike that I'm on in that picture. Thank you, perfect. And also just think about deer. I'm guessing that in these deer crashes that we were hearing about earlier on, it's probably not that great for the deer either. So I'm going to talk about assessing and valuing the barrier effect of community roads, what we often call community severance. So I'm going to start off by saying what community severance is or might be, why it's important for health and for health inequalities. I've been trying to give lectures in various different countries and languages. I'm not very good at American, but I think that you call them disparities. And then talking about our street mobility toolkit, and I do have a few copies here. So what is community severance? Well, when I was doing my PhD, I found this great paper, and if I slightly misquote, for older people, isolation can be regarded as a combination of distance to other places and the resistance of the landscape between them. The road network will probably contribute considerably to the resistance between them. And it talked about higher traffic density, increased mortality, as well as increasing isolation. The negative effects of roads are often underestimated. And I thought this is a really good description of what I'm trying to study. But actually, the words in italics and brackets are mine, not theirs. They were actually talking about frogs. And the quote actually reads, for ground-dwelling species, isolation can be regarded as a combination of distance to other habitat patches and the resistance of the landscape between patches. The road network will probably contribute considerably to the resistance between habitat patches. Mortality on roads can have a considerable impact on amphibian populations and eventually can lead to extinction. That's the real reference. It's not just frogs and perhaps deer. According to the Worldwide Fund for Nature, the giant panda population in China is growing. Good news. But it's divided into 33 groups, and many of them are very small groups, and 24 of these groups are thought to be at risk of becoming extinct, partly because of climate change, which is reducing the area where bamboo can live. And at the same time, new roads are being built, and these roads and other infrastructure could fragment the bear's habitat, making it even harder for them to access what was the previous full range or to meet with other groups. But there is some good news. The National Highway 118 in the Jingling Mountains created an impassable barrier between two of these groups. But in 2007, they decided to reroute the road through tunnels and replant the area where the road had been with bamboo so that the pandas can get across. So this is an example of community severance where there has actually been an intervention to solve the problem. Now, as part of the work that we did, we looked at various existing definitions, or one of our researchers, Paulo Anciais, did. So this is a word cloud from definitions of barrier effects, and you can see the traffic, road, pedestrians, crossing, infrastructure really stand out. And this is our definition that we came to during our project, and it differs from others in that most people are talking about the road as a line that you go along or across, whereas ours is more area-based. Transport-related community severance is the variable and cumulative negative impact of the presence of transport infrastructure or motorised traffic on the perceptions, behaviour and well-being of people who use the surrounding areas or need to make trips along or across that infrastructure or traffic. And in many cases it's and, not or. So what are the potential impacts of busy roads on health and well-being? Does this look familiar? Are you familiar with the work of Appleyard and Mindell? No. Okay. So in 1972, Donald Appleyard and Mark Lintell published a paper in the Journal of the American Institute of Planners called The Environmental Quality of City Streets, the Resident's Viewpoint. They had done this research with 3 streets in San Francisco, which 20 years previously, when most of the people moved in, were very similar. But over the time, both the streets and the people, but over time, traffic had increased. Interestingly, given what we would now consider normal traffic levels, the light traffic street at the top had 140 vehicles a day. Medium traffic had just under 8,500 vehicles a day, and the heavy traffic was just over 21,000 vehicles a day. I'm not sure how you'd classify those today. But they asked people how many friends they had and how many acquaintances they had on the street. And you can and then plotted the lines. So on the light traffic street, people had on average nearly 5.5 friends and over 6 acquaintances per person. On the heavy traffic street at the bottom, they had just over 1 friend and under fewer than 3 acquaintances per person. 9 years later, they published a book called Livable Streets. Donald Appleyard's son, Bruce, a few years ago produced a 2nd edition and is now working on a book called Livable Streets 2.0. We've written a chapter about this work, and that'll be coming out sometime in the next few years. But the book has far more information about these and other people. So, for example, they asked, what would you consider your home territory? And most of the people on the light traffic street had their own home, all the pavement on their side of the road, and a sizable chunk of the sidewalk on the other side of the road. Somewhat less for the medium traffic. On the heavy traffic, some of them might have their home in the next door home area of the sidewalk. Some people only outlined the rooms at the back of their apartment because of the noise level, meaning that they didn't want to live in the front of their own apartment. So a huge range of effects that I haven't got time to go into here, but this is where the work really started. And again, a word cloud of definitions of community severance, traffic, people, social barriers are coming up. So as part of my PhD, and then Saffron Carlson and I updated the review and published this a few years ago, looking at community severance and health. And what I found, and then in the updated version, we found loads of reports, loads of scientific papers saying community severance is bad for health, and not a single study actually looking at it. So In red, there's a negative effect. In blue, there's a positive effect. Solid lines, we know this happens. Dotted lines, we think it happens. So the greater the volume or traffic of speed, the less pleasant it is to walk or cycle. The more people make detours because they can't get across or because they prefer to walk somewhere less unpleasant. It reduces physical activity, it reduces independent mobility, and that applies particularly to the old and to the young. And if children aren't allowed out, it actually impairs their mental and physical development as well as their self-esteem. Impairs the use of street as social spaces, again, particularly by older and younger people. More journeys aren't made. It interferes with social networks and reduces access to services, goods and people. And these can affect mental and physical health and inequalities in many ways. So what are the potential effects on inequalities? Well, there are lots of benefits of transport itself. When we talk about transport and health, there is rather a tendency to focus on the harms of transport and forget about the benefits. And the benefits are mobility and access, as well as physical activity that I'll come back to. So lots of benefits of transport if you can access the transport. But I rather like this quote from Enrique Peñalosa, who said, "A developed country is not where the poor drive cars, it is where the rich use public transportation." In general, the poorer you are, the more deprived area you live in, the more likely you are to be exposed to air pollution, because in most countries, cities, if you can afford to live where it's not so polluted, whether it's noise pollution or air pollution, you choose not to live there. But there's a double whammy, because people who already have cardiorespiratory disease, circulatory diseases, lung diseases, are much more susceptible to the health impacts of pollution, as are people who are very young children and babies and very old and frail. And in general, the poorer you are, the worse your health. And therefore, the poorer you are, the more likely you are to be exposed to something that is more likely to harm you, given an equal exposure. The good news being that if you can reduce air pollution, you can actually reduce inequalities. So the people living nearer the main roads where there is more noise and air pollution are more likely to be harmed by it and more likely to be poorer. There's also noise pollution. Now, noise affects blood pressure, it interferes with sleep, and it interferes with concentration and learning at schools. And education is actually one of the most important predictors of adult health. The more educated you are, the longer your life expectancy, the lower your mortality in general. There's also inequalities in injuries. Now, there have been a lot of studies showing that if you look at the location of road travel injuries and fatalities, that these are much higher in more deprived areas. We did a study published earlier this year in the Journal of Transport and Health, looking at differences by variations by age, gender and deprivation and travel mode, and found that the variation in fatality rates were much higher by age and gender than they are by travel mode, with cycling and walking, if you include pedestrian falls when you're walking for travel, being almost the same, and driving not being that much less. And we found that males aged 17 to 20 were much, much safer if they cycled than if they drove. And the statistician working for me, Sean Scholes, also published a second paper in that same issue, and he showed that everybody else is much safer if the young men cycle, not drive. But what Rebel Faleki also showed was this difference in death rate by deprivation of where people live, not just where the injuries occur. And when we're saying all fatalities, it's actually not all. This is drivers, cyclists and pedestrians, because those were the modes of travel for which we had denominator data from our national travel survey. And this is fatalities per billion kilometres by index of multiple deprivation, comparing the top and the bottom quintiles. Social isolation is an increasing problem in high-income countries, particularly amongst older people, and particularly in populations where there are increasing numbers of older people. In general, although age-specific rates may be falling, but there are more people who are getting older, and in general, as you get older, your health gets worse. You may be less able to walk or cycle. You may not be able to cross the road. We published a paper in Age and Aging a few years ago showing that 4/5 of people aged 65 and over in a general population survey had a walking speed less than 1.2 metres per second, which is the clearance time for signalised crossings in the UK, Australia, Brazil, USA. So you may not be able to get across to get to a bus stop. So even if you're within walking distance of public transit, you may not be able to get. You might be able to get there, but not back, or the other way around. And because of the deterrent effect of noisy, polluting, dangerous cars, there are fewer options for safe spaces to meet and socialise. And we know that work by Berkman and Syme, published, the original Alameda study was published in 1979, and more recently, Holt-Lundstedt did a meta-analysis of about 145 studies. We know that the bigger your social network, the better your health. The lower your social network, the worse your health, the higher your risk of hospital admission, the higher your risk of disease, the more likely you are to have unhealthy behaviours. And Holt-Lundstedt's meta-analysis showed that the magnitude of this effect on mortality was much bigger than people had realised. It was similar to the benefits of quitting smoking. So this is a really, really big effect on health. And therefore, if community severance, which tends to be described as the effect of traffic and infrastructure on preventing access to goods, services and people, that's probably where it has its biggest health impact. So we had funding. I did show our funders, so 3 research councils in the UK, and we had these objectives to increase understanding of residents' perceptions and priorities regarding community severance. Obviously, we didn't use the term community severance other than within our research group. To develop questionnaire tools to measure severance at an individual level, to develop a community severance index based on readily available data, to estimate values of reducing community severance, to test the measures, and to analyse the impacts on well-being and other social outcomes. So to go through the various different aspects of the tool. So participatory mapping, which was done by an organisation called Mapping for Change, which is a social enterprise body. So we had 4 case studies, and in each of them they went to community groups, particularly older people's coffee mornings, lunch clubs, talked to people as groups or as individuals. They also stopped people in the street and said, if we buy you a coffee, can you give me 5 minutes of your time? And we were asking questions like, so we had a map of the area. Where do you go? How do you get there? Where don't you go? Why not? Mostly open-ended questions, which got us into trouble with one of the case studies when people, almost all the comments we got back were about a pedestrian, a shared space area outside the station, which was on the map, but it wasn't our case study area, which was a busy dual carriageway. And the local government transport planners were furious that we'd been asking people about this thing, but we hadn't. It was qualitative research, it was open-ended questions, and that was their main concern. We also asked people to draw on the map what they considered their neighbourhood. And interestingly, the older they were, the smaller the area they drew. We did a questionnaire which went to 200 random addresses within our case study areas, in each of the case study areas. We designed it as a pen and paper questionnaire because we wanted it to be something that local community groups could use, as well as researchers or local government. It asked some demographic and socioeconomic information, but it mostly asked about questions about people's own road and about the busiest road near them, and we asked them to name the road, and we geocoded the data. Whether and how often, which went from none to all the time, they had problems from heavy traffic, fast traffic, air pollution, noise pollution, and a few other questions. We also asked whether they had any difficulty, which went from none to a lot, walking around their local area, say about within a mile or 20-minute walk of your home, which included similar things, also the lighting, the state of the pavement, fear of crime, various other questions. And we also included in it the short Wenweb's Warwick Edinburgh Mental Wellbeing survey. We started off with a 14 item and had loads of missing items, and when we used the 7 item one, we got almost complete responses. We also asked a few questions about people's health and about any disabilities. We tried to do a question that would relate to the Appleyard and Lintell diagrams, but it really didn't work, partly because our case studies often were blocks of apartments, so it made it much harder, where as opposed to being a house which has 1, 2 or 3 households in it. And partly because in our first case study there was the main road and the blocks of apartments were on little side roads which really didn't have any traffic. So it didn't make sense, and it was the least useful of our questions. We dropped it. I'll come back to the stated set preference survey later, and this was trying to get some valuations. We did spatial analysis using space syntax, street audits using the Transport for London PERS, which is the Pedestrian Environment Review System, and is a very complicated way of auditing both the links and the junctions in an area. And we did video surveys. So these were our 4 case studies, 2 in London and 2 outside London. I went to school just up the road there, and this wasn't like that back in the day, but it really is very unpleasant walking along there. There's no risk of being injured by cars because you'd have to be 20 foot tall to be able to get anywhere near the road. So I've mentioned the participatory mapping. This junction was just up the road from that previous slide I was showing you, and everybody mentioned that as being horrible. And there's a nice little community theatre just there, which I go to, really difficult to get to. The survey. So space syntax and network analysis methods measure the centrality of networks based on the geometric simplicity of traversing shortest paths between origins and destinations. I hope that's clear, because that's the extent of my ability to explain space syntax, which is done by my colleagues in the Bartlett School of the Built Environment. The darker the blue, the less easy it is to get from that location to anywhere else. Red has great connections to everywhere. So in Finchley Road, that nasty junction I showed you was here, that bit of road is there, and this was the very busy road. Ashley Donani, who is one of the researchers on the project, developed a walkability model which reflects the potential for walking rather than how much walking is actually done. And he used space syntax rather than number of junctions or any of the other measures that have been used in previous walkability models. And what he worked out was that community severance appeared to be occurring in London where high walkability, so these peaks, and this also shows you how London has got lots of little local high street and local city centre, town centres. So where high walkability coexists with high motorised traffic levels. So Finchley Road that I just showed you really has motorway level traffic. And we tested this out for Birmingham. Instead of going to the local government and saying, where do you suggest we have as our case study, he actually did a walkability model for the whole of the greater Birmingham area, overlaid it with traffic levels, identified 6 places where both were high, and then we went to the local government and said, tell us about these these areas and anywhere else where you think there's community severance. And they said he'd identified the worst spots through his model. He then made walkability and models for each local authority in London, and he's working on a UK-wide model. So this is the street audit, and so it's well paved. It's it's unlit. It's very scary after dark, and crossing the road here, despite the signals, is pretty awful. With the video survey, some of these were cameras that were already there under local authority control, but mostly we had to pay for 24 hours. And we had a 16-hour period taking 15 minutes every hour. And what he did was count motor traffic and pedestrian traffic going along the road, also across, and where people were crossing the road, formal crossings or informal crossings, how long they had to wait, and the ratio of people crossing compared with the number of people walking along the road, and also comparing the actual pedestrian flows with what you might expect from the walkability model and the space syntax model. And so, for example, in our first case study in Seven Sisters, we found far less pedestrian traffic along our key case study road, and far more down another road, again suggesting that it was very unpleasant and people were deliberately avoiding it. So that's the road that had a lot of pedestrians, and this road had very few. This is an example of informal crossing. People get off the bus and they walk across the road using desire lines rather than where the traffic planners tell them they should be crossing. And here again, so blue is walking along the pavement and crossing a side street. Green is walking along the pavement. Yellow is a signalised crossing. Red is an informal crossing, and this is a zebra crossing. And this was the percentage. This was the percentage of people on the crossing who had an appearance of being mobility impaired, and we realised this is completely underestimating mobility impairment, but using the cameras, it was better than nothing. Turns out that there was actually a health centre at one end of this crossing, so I suppose it does add a bit of validity to our thing. So the stated preference survey. So people were initially, it was done on a computer, of the interviewer's computer, and they were given a situation, so the amount of traffic, low, medium, high, the speed, whether or not there was a median strip, whether there were railings, and given this scenario, there's a bus stop on the other side of the road that's cheaper travel zone than the bus stop on this side, or you can get a newspaper more cheaply if you cross the road here than if you walk 100 yards, than if you go up the road, and you can cross the road here, or you can walk along the road for X minutes to get to a different sort of crossing. And for where we had this type of crossing versus that type of crossing, we also had to introduce a third option because so many people said, well, I wouldn't cross it at all. And they were a random sample of the different scenarios and changing different connections given to lots of people. And from this, Paolo is creating a severance index. So 0 is there's a grade crossing for pedestrians, cars go underneath, there's absolutely no barrier and no problems at all for the pedestrians. And at 100 is you can't get across. And in between. Ignore the actual amounts because this was based on the initial 400 people. We then did one and now a second Great Britain-wide survey to get more representative data, because our initial survey was just of people in areas where there was severance, or we thought there was, whereas the random sample across the country also includes people where there isn't. So the amounts change, but they're important because if you try to do something about community severance, it costs money and local governments and transport authorities don't have money. But if you can actually show, well, actually it's already costing money, and this is how much you can reduce what it costs, it helps to make a business case, because quite a lot of the transport planners we spoke to said they really wanted to do something, but actually getting a business case through would be difficult, and this would be very helpful. So he's also developing a tool, and you can put in the current scenario, and you can consider what the future scenario would be. You can change the conditions. You can actually design where you might put in a different sort of crossing. People hate underpasses, they don't like footbridges, they will tolerate staggered pelican crossings, and what they really like is a straight signalised crossing. And then the tool will have different outputs, and you can disaggregate it by age, by gender, by trip purpose, and so on, and get all these sums. So we came up with this toolkit. As I say, I've got 4 copies here. And it's designed to assist local government, consultants and local communities to better understand community severance and what they can do about it. It provides advice on how to measure community severance and to assess impacts on local communities. Some of the tools are aimed at local communities, others would be transport professionals to use. So the content, there's an introduction which gives an overview of what's in the toolkit. What we know, both a summary of the evidence before we started this work, and also what we found in our study about the effects of busy roads on local people. Participatory mapping, which is a little bit about the approach, how to do it, and case study. With the survey as well as the case study and a bit of introduction to the survey, there's copies of the actual survey both in PDF and in Word, so that if people want to amend it or write in the name of a particular road or drop some questions and insert others. And we also did some how-to guides. So there's a simple English guide on how to do a survey, and another one on how to analyse the data, and an Excel spreadsheet which does very, very basic analyses. But the idea was that if there wasn't anybody in the local community who had the statistical skills to do any more, they could do a bit and then go to local government and say, look, here's our data, here's our initial findings that shows that there is a problem, and if you want to do some more work on it, we can give you the data. Some description of video surveys, what to do, and a case study. It's actually being used in Havana at the moment by some architecture students, only they're not using videos, they're just standing there themselves with pen and paper doing an awful lot of observation and work. The walkability model, again, an overview and a case study, evaluation tool. There's a bit of a summary, but the tool itself isn't yet available because we decided to increase the numbers in the national survey. That's now been done, and Paolo's analysing them. And other useful tools that we didn't invent ourselves, but are suggested. So, for example, street audits, and we mentioned 2 or 3 different tools that people can use, and space syntax, where I believe that the software is actually free to use, but most people don't have the technical skills to understand it. And if you want to use the UCL Space Syntax Lab, you have to pay them. The introduction also includes this table about what the tool is, why you use it, what it can give you, and what resources are needed in terms of people, expertise, money, and time. And the idea is that it's a pick and mix, that if you really, really want to know about the area, you might want to, and you've got the resources, you might do all of them. If you have a particular question that one tool will answer, or if you've only got the resources available in terms perhaps of people and expertise apart from money, then you can use what fits your needs. So if you want to find out more about it, do look on our website. On the project website, we also have all our publications. We've got working papers, we've got peer-reviewed papers in peer-reviewed journals. They're all open access and can be downloaded. We've got presentations from various conferences, and there's the actual tools and toolkit itself. Just to give credit where it's due to my colleagues, Professors Gross, Hackley, Jones, Scholes and Vaughan, people from Mapping for Change, and various researchers who have been involved to a greater and lesser extent. And finally, perhaps a vision for the future, which I think might chime with the theme of today's conference. The old men and women shall again dwell in the streets, every person with their staff in their hand because of great age, and the streets of the city shall be full of boys and girls playing in its streets. So, thank you.